Hello, I'm Dr. Robert Valente, a board-certified rheumatologist at the Arthritis Center of Nebraska. I am frequently asked to distinguish between arthritis conditions and chronic pain related to fibromyalgia, otherwise known as FM. Learning more about FM will help patients cope with their pain. Fibromyalgia just means I hurt all over and I have hurt for more than 3 months, without another reason being found. Fibromyalgia affects at least one part of the spine, the neck, the mid-back, or the low back, and at least 3 other areas on either side of the body's midline, and has to have pain that involves at least one area above and below the belt line as well. Primary symptoms of fibromyalgia are a gnawing, aching pain. Patients with fibromyalgia will describe having a bad bout of the flu that just won't go away. Overdoing it, pushing beyond your usual emotional or physical limits, having worse sleep than usual, more stress, or bad weather can aggravate your fibromyalgia. Fibromyalgia is not arthritis, and there is no physical disability that can distinguish FM. There are no diagnostic blood tests or x-rays to confirm the presence of fibromyalgia. In addition to widespread pain at muscle attachments around the body, patients frequently describe numbness, tingling, or a sensation of swelling in the hands. Many fibromyalgia patients have fatigue. Doctors have used a number of tender points to define the fibromyalgia when they examine you. However, symptoms of widespread pain and fatigue, when the other criteria are met, are adequate for diagnosis, regardless of the number of tender points they find on exam. However, symptoms of widespread pain and fatigue, when other diagnostic criteria are met, are adequate for diagnosis, regardless of the number of tender points we find on examination. Patients with fibromyalgia are generally more sensitive to their environment. They are sensitive to weather changes, a low bank balance, criticism or potent smells, a firm mattress, or having to maintain a posture for a long period of time. Other problems coexist with fibromyalgia, and that includes numbness and tingling of the hands or toes that can come and go, headache, irritable bowel, restless legs, fluctuating mental sharpness, or fibrofog, even anxiety or depression. Anxiety affects about half of all patients with FM, and about 1 in 6 FM patients are actively depressed. This is about the same proportion as actively depressed physicians. Fibromyalgia, or chronic pain and fatigue, influences and perpetuates complications in every facet of an FM sufferer's life. This illness has to be managed. There's no cure. Management means lifestyle and expectation changes. Accepting the need for change may be one of the first challenges you'll have to meet. There is no one best way to solve this problem. Social, financial, and physical limitations all have to be considered. Warm water exercise is a wonderful help for FM. However, everyone does not have access to a warm water pool. Few people, however, lack a shower, so we can find a way around that. Request that others modify their demands on you so you can make these changes in your life. Don't rely on your doctor, your family, or anyone else to make these changes for you. And recognize that medications are no substitute for these life-changing actions and expectations. Medications can help a little. They all have potential side effects, and benefits also have to be balanced with those adverse symptoms. Remember, fibromyalgia patients are also sensitive to medicines. Start your self-management journey by learning more about fibromyalgia, about what pushes your buttons, and about problem-solving strategies that you can use to better survive with FM. Remember, you cannot control what happens, but you can control your reaction to it. Take the time to develop reasonable expectations of yourself and those around you. Solutions to problems, even changing your priorities, your short and long-term goals, will become easier. You have to manage your symptoms of pain and fatigue. Lifestyle changes, paced physical activity, better postures, better flexibility, and comfortable surroundings all can help. I tell people that if you are stress-free, you are probably dead. So don't just complain about stress, do something about it. What can you do? Say no without guilt. Don't set impossible deadlines or goals for you or others. Use relaxation techniques to diffuse the stress that is inevitable. Here you see listed some activities that can help control stress. Learn how to manage your emotional reactions to stress. Avoid people that produce negative emotions and steal your precious energy. Build positive relationships around cooperation and better communication. Avoid manipulating those around you with your symptoms of pain and fatigue. Define your purpose in life and avoid defining other people's behaviors. Management of fibromyalgia is not easy. It's not easy for you or your doctor. Your doctor is just one member of your team, helping with medications and making sure there are no other diseases contributing to your symptoms. Try to find an exercise buddy. You may also need a fibromyalgia coach, someone that can help you keep on track with expectations, focus your energy, and also keep your eyes on the fibromyalgia management goals. That is the secret to successful fibromyalgia management. Thank you for your interest in learning more about fibromyalgia. Our team of Mayo Clinic trained and board certified rheumatologists at the Arthritis Center of Nebraska consider it a privilege to help people with arthritis and autoimmune diseases. We invite you to call 402-420-1212 for more information or to schedule an appointment.